I'm the CEO of Health Research Charities Ireland, which is an umbrella group for 40 charities with a strong focus on health research. We run the Irish Health Research Forum under the guidance of an excellent steering group of stakeholders from diverse backgrounds. So while we are very sorry that this is online and we won't get to see you in person, we are delighted to be able to run it because we believe it's a very important topic and one that is ripe for discussion. We're dealing with a topic today of enormous potential, but also enormous challenges. Everyone is awakening to the realization that genomic data is valuable. And as they say, data is the new oil. And of course, things often get tense when money is involved. Genomics research is also very powerful. It has the power to literally improve people's lives. And finally, it is, of course, at the heart of who we are as individuals and people. So that's a very heady mix. And I guess it's not surprising that sometimes it becomes quite emotive. Um, because this is an area for which success involves many types of expertise. So it spans research and clinical care, patient and public needs, ethics, data protection, bioinformatics, it goes on and on. The IHRF steering group decided that we should capture the view of a range of experts in the field and bring them together in a discussion paper, which you hopefully received in advance of the meeting. And what I'm going to do for the rest of my short piece is to pull out some of the strong themes that emerged from the 21 submissions to that paper. So I read through them all many times, and I've pulled out 5 themes that I felt came through very strongly. So these fall under the broad headings, 5 broad headings. The first being realizing potential. So we've moved to a point where greater scale and speed in genomics technologies have opened up immense possibility. I think that for those of us not working in clinical genomics, the reality of that power can seem a bit intangible at times. However, what came through very strongly is that cancer treatment has become the embodiment of the power of genomics. Irish patients are today having their treatment plans shaped by both genomics research and also by their own genomic data. The challenge for us now is how to more fully realize that potential in terms of all forms of cancer, and also to extend the benefits to other areas of health, such as rare diseases. Um, and that's not going to just happen, of course. So that leads us into the second theme, which is around preparing. How do we prepare for the avalanche of data that's coming our way? And how can we use it to benefit the Irish public? There is a very clear call out through the discussion paper for a genomics policy or strategy for Ireland, whichever term you want to use. Both the Department of Health and the HSE are very aware for the need for this. In fact, both were invited to participate today, but unfortunately, neither were able to put anyone forward. But it hasn't happened yet. So how do we move that along? Training is another important aspect of preparing. The training of healthcare professionals for including genomics in future patient care. It's one thing to generate data, but we also need people who can interpret genomics information for patients and for the clinicians providing their care. And there are too few of those people presently. Finally, under this theme, we need to prepare the digital underpinnings to support the use of genomic data, including electronic healthcare records. The third theme is around sharing. So to realize the potential of genomics, we need to both share the data, genomic data, but also clinical data. That's where the real power lies, where you combine the two, but also to protect it. In this, we need to be guided by international practice, and informed patient consent, truly informed consent, needs to be at the heart of sharing this personal health data. Another aspect of sharing is the sharing that needs to happen across borders. So an all-Ireland approach makes a lot of sense, as does working internationally, such as with the European Beyond 1 Million Genomes project. Collaborating in this way will make us more effective, but yet again, we have still to make substantial progress. The fourth theme is around investing. So there's a strong wish to see state investment in a national genome project. This was mentioned over and over again by people from all perspectives. Commercial investment in genomics raises a lot of strong feelings. For example, in fully commercial ventures, Are the potential benefits too stacked in favor of the financial investors over the patients and members of the public that have contributed their DNA? Is some vague hope of a future potential drug enough for those people that gave their DNA? There was also a lot of talk through the paper about the potential for public private partnerships, with many believing that a level of private investment is very helpful, but best done in partnership with public initiatives. This is obviously something that needs to be carefully thought out. For example, how long do private partners have exclusive access to the data? Their investment obviously needs to be worth their while, but the period of exclusivity they have should not be so long as to block or to delay research of potential benefit to patients. And finally, but most importantly, there was a strong theme emerging around prioritizing patients. Simply put, it is all about and should be all about patients and future patients. Regardless of who is investing their time and money into genomics research, the needs of patients and the public must come first. If we lose their trust, we lose genomics and all of its potential. A big part of prioritizing patients and the public is to ensure that we understand their perspectives. This is the best way to do this is to involve them in all decision making from the earliest stages, so-called PPI, patient and public involvement. And in that we have a long way to go, but it does need to start now. In finishing up, I have talked a bit about the challenges. However, when I read through all the pieces submitted to the discussion paper, I was actually left with a sense of hope. There's strong agreement across many of the emerging themes. Also, many of the contributors highlight the strengths that we have in Ireland, including a population very suited to genomics research, pockets of research excellence, an internationally well connected research community, skills in data analytics and bioinformatics, and we are getting very good at patient involvement. So, a huge thank you to everyone who's submitted to the discussion paper. I have used many of your thoughts for this piece. And thank you to all of you who've joined us here today. And I will hand back over to Evelyn. Thank you.